Hello everyone, how are you all? I hope you all are doing good. Yes, and you know me well, I am Miss Manoranjini, your mental health nursing faculty, and this is the YouTube channel, your nursing companionship. Yes, so how are you? How are you feeling today? I hope it is great for everyone. Maybe it will be a good day or not so good day. Yes, but anyways, we have to pass through it, and we hope the best thing will happen in our life and our life will change into a good deeds. Yes, okay. So with that, we'll get into the today's discussion. That we are talking about the series of information about mood disorder. Yes, so yesterday in the previous video we have seen about the difference between mood and affect and what is mood disorder. Yes, maybe it can be a meaning or a definition of a mood disorder. Yes, and today we are going to see about mood disorder and DSM-5 classification. So what is the DSM-5? It is Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Yes, there for the period of time there will be revision in the edition, and now we are using the 5th edition of DSM. So it is called as DSM-5. Okay, right. So it classifies mood disorders as depressive disorder or bipolar disorder. According to DSM-5, DSM classification of 5th edition, the mood disorders are classified as a depressive disorders or a bipolar disorders. Yes, so mood disorders are mental health condition that causes significant change. It means a remarkable change in a person's emotional state. That is known as mood disorder. So now we'll come to the classification. Depressive disorder. That depressive disorder is further classified as major depressive disorder and persistent depressive disorder. So what is that major depressive disorder? The symptoms of major depressive disorder includes persistent thoughts of death or suicide. It means always the person will have the thought of death or sometimes committing suicide, and depressed mood, sad mood. Yes, the person will be socially isolated, not involved with the society, not involved with the others, not maintain a good relationship or a friendly environment, right? That is major depressive disorder. Next is persistent depressive disorder. This persistent depressive disorder is otherwise called as dysthymia, right? This is the important viva based question. What is dysthymia? Dysthymia is called as a persistent depressive disorder. Yes, so it is the combination of chronic major depression and dysthymia. Yes, there will be a combination of major depression. We have discussed previous now what is major depressive disorder. So that this dysthymia is a combination of major depressive disorder and dysthymia, which is defined as 2 or more years of continuous and major depression. So the duration of the depression will be 2 or more years. Yes, of a continuous major depression. It means having a thought of death or committing suicide, socially isolated, having a depressed mood. Okay, so these all will be in the persistent depressive disorder, which is otherwise called as dysthymia, right? So next we are going to see about bipolar disorders. So this bipolar disorders are further classified as bipolar 1, bipolar 2 and cyclothymic disorder. Yes, so what is bipolar 1 disorder? It is a manic depressive disorders that involves period of mania lasting at least for 1 week. Yes, it is the manic combination of manic and depressive disorder, whereas mania will remain for the period of 1 week, at least for the period of 1 week. That is bipolar 1 disorder. What is bipolar 2 disorder? It is a combination of depressive and manic episodes that are usually less severe. Yes, bipolar 2 disorder that is usually less severe and don't impair the person's ability to function. Person can function normally. But bipolar 1 disorder will have the duration at least for 1 week. Whereas bipolar 2 disorder, it is the combination of depressive and manic episodes, but it will not affect the normal functioning of life. Okay, and it is not that much serious also. Okay, next is cyclothymic disorder. So what is cyclothymic disorder? It is a cyclic disorder, involves brief episode of depression and hypomania. It is a cyclic disorder. Brief episode means a short episode of both depression and also hypomania. right? So these all comes under bipolar disorders. So we have seen about depressive disorders and bipolar disorder. Yes, so this DSM-5 also includes a category of unspecified mood disorder. It means where the symptoms are not significant. You cannot say as significant. The symptoms are not fitting into any of the criteria. Right, it will not fit into any of the criteria. You cannot say whether it is a depression or it is a mania. Yes, so that is unspecified mood disorder. This category is used when the symptoms or characteristics of a mood disorder, but they don't meet any specific diagnosis. That's what I have told previously. Yes, there will be symptoms, but that symptoms will not fit into any particular criteria. You cannot say it is a mania nor depression. Okay, so there will be a confusion between these two disorders. Yes, so that is this is about DSM-5 classification of mood disorder. It includes depressive disorder and bipolar disorder and also unspecified mood disorder. Yes, I hope this will be very useful for you. Go through the complete video. You will not miss any of the concept so that you can understand it and prepare yourself for the future examination. It is important for both theory examination as well for a Viva based question. It is also important for your NORCET examination. Yes, so with this, we'll see in the next video. Till that, it is signing off. Thank you.